James Clem, how's it going today, buddy?
Hey, I'm in a different background. You see
we
that?
got we got a little background noise right now because we got Tuan Pham coming up on. He's out on the coast. You know what I say we do? I
What's
say
that?
I say we just go right to him right now because you
I
got
look
to
at you.
you got to see
That's
this
where I want to
fish.
be.
This guy. First of all, let me say thanks for meeting with me again this morning. You're always a blessing, and I am doing good. How are you feeling today? How's your heart? You always ask me.
Well, I'm a little lonely. My boy Jordan, my dog,
Yeah.
he's home right now. He's getting a bath lift, and I had to come over here to the office because the Wi-Fi is really popular at home. And even though we have a fast system, it's not fast enough for everyone to be on. But I had a good walk this morning. I have good spirits today. I have a sense of hope. I'm really looking forward to talking with Glenn about hope
Yeah.
and maybe some fishing.
Yeah, he's got a little wind noise coming in, so we're going to go right to it. But you know how my heart feels today as a
Yeah.
dentist? I'm feeling essential. Nobody's going to tell me I'm not essential today. So I'm essential. All right,
Yeah.
let's bring in Twan now. And there's my friend. How you doing, brother? You doing all
I'm
right?
doing great. Yeah, I'm at the
Hey,
coast. It's a little windy. Sorry about that, but
that's okay. We'll have to deal with it. So tell us where you are right now.
I'm in Rockport, Texas right now. I'm in Rockport. You may know is the place where Hurricane Harvey a couple of years ago went right over. The hurricane actually went right over my house. It was the eye of the storm and got destroyed. But since you're talking about hope, it was rebuilt just fine, even better. And you know what? We got the quarantine right now, or the shutdown, and I just accepted it. It's like I'm in the acceptance stage of everything and enjoying this as much as possible. I mean, we can't go to work. We shouldn't go to work at this moment. So why not do things that you want to do? And so myself, I like fishing. I like enjoying the outdoors, enjoying the breeze. So I'm just out here and I'm talking to two of the most awesome guys in dentistry right now. So
Uh,
what more can I ask for? I mean, this is a great day.
hey, Twan, I want to hear
Yes.
a fish story. I
All
heard this
right.
good fish story from yesterday.
Yes. So one of my good buddies lives down here, and of course, once my baby goes to sleep, it's fishing time. And so, we do what we do. We got some beers, we got some whiskey. We're just out fishing in the dock back here, which you can see in the background. And, we're hanging out and then just casting some lines out.
Oh
I'm a big,
yeah.
yeah, I'm a big fly fisherman, but, I will say, especially when it's windy back here, I just throw some bait out there. And then the next thing, it's like there are a bunch of little fish biting, and I just feel like this bite that's like nothing significant, but I'm like, it's pulling the line just a little differently. So I'm like, why not? Setting the hook is free. Set the hook, and then before I know it, I have this train, this tank on. It's my personal record for a fish down here off this dock. 31 inches, 17 pounds. We measured it with the scale. It
Wow.
was I mean, my friend and I probably woke up the baby, like screaming and hollering, dancing back here, like unbelievable.
But a
So
moment.
yeah,
Todd has your picture up there on the screen right now with your fish.
Yeah, no,
the big boy.
I
And
had
it
it
looks
up.
really good.
Yeah, it's
And
really
you look
good.
extremely happy.
Oh yeah, who wouldn't be? I mean, this. You know what? It's like every time I go down here, it is my goal to catch a monster fish of this size because I've seen my neighbors catch it like on and off. And after 8 years of going down here and fishing for these big boys, and now finally having like the equipment rigged up as I want to not lose it, I finally landed. So, hey, you know what? It's my quarantine fish.
Amazing. Twan, you're known for efficiency around the globe with your team and how you structure your life with your practice. How's your team doing? How are you processing communication right now and giving
Yeah.
hope to the whole process?
Well, we're on a group chat with our phones, and it's just how we keep in touch a little bit.
Yeah.
Uh, now that we're going to reopen 3 weeks or so in Texas, we're going to do Zoom chats and stuff like that to talk about ahead of time. But in the meantime, we just kind of keep in touch. I just tell my office, first thing I tell them is like, and I'm sure a lot of us have gone through this. It's like stages of acceptance. Like
Yeah.
at first I was a little angry. I was in denial that this was happening. It couldn't happen. But then, what can you do about it? Like I'm not a virologist. I'm not an epidemiologist. My job is to do what the experts say, and they say, you got to stay home. So we got to stay home. What are we going to do? We might as well enjoy the time as much as we can. I always talk about, and it's hard for all of us, even myself, but try to view things in different light. Like my daughter is 3 months old right now. And you know what? First thing as I'm thinking about it, I'm like, this is like a paternity leave that I wouldn't have taken myself. But now I get to watch my daughter grow and acquire new skills every month. And she's just getting bigger and smarter. And then on top of that, I like to fish. So we're like, let's go to the coast on and off. So we've been down here on and off, enjoying the outdoors. I mean, this is fresh air. It's a small town. There's no corona in the air, so we're not going to do it.
Hey, Tuan, it almost sounds like you don't want to come back.
Well, you know what? This is a test run for semi-retirement. I kind of like it.
Got to practice.
But go back to your question. I mean, I talked to my office and I'm telling them, I'm like, hey, you know what? Of course, this gets a little technical and nerdy, but it's all dependent on your area. But the area I live in, it's a lot of tech jobs. People are working remotely. I'm actually the only person among all my friends beyond dentists that aren't working. And so in my area, I feel like when we reopen, and I know because I've been checking emails on and off with patients, we're going to have a full schedule or a very highly filled schedule. And so I tell my office, I'm like, hey, you know what? We've all been working for a long time, many of us 10, 15 years or so. It's like our sabbatical, We're doing everything that we can to maximize it, meaning that, my employees have support from the government. I pay them all their bonuses and PTOs and everything out. So we stockpile some cash as much as possible. And I'm just telling them, hey, just enjoy this time. And now my staff are gardening, they're taking walks, they're exercising, they're cooking a lot, so make the most of it. And then, that's what we talk about. We share pictures of what we do the day, the week. And, I tell them, I'm like, it's funny. Normal life doesn't seem too bad now that we're out of this normality. So we're kind of looking forward to it. And I'm like, you know what? I'm glad you guys are a part of this team. I'm going to do my best to make them feel comfortable when we start. I've been trying to procure N95 masks. I got air purification as best as I can tell to make the air cleaner at work. So we're going to discuss these things. But my job, when we get closer, which we are, I'm going to talk about things to make them feel safe, which is one of the most important things.
Yeah.
I don't want them to be at risk. I don't want patients to be at risk. Again, I have to trust the experts that they say it's okay to go to work, and we'll follow or exceed all precautions to make things comfortable for patients and certainly staff. Because one of the biggest things in dentistry is that you got to think about the viewpoint of a patient. Everyone, we're smart people, we're technical people, so we do a lot of reading, a lot of studying to understand corona as much as we can. But a lot of people, they don't, and they may have preconceptions, they may have fears, they may have unknown things about it. So one of the things I think is real important is, as we all reopen our offices, is that we reach out to our patients and explain how, just what we're going to do to make them feel as comfortable as possible.
So, Tuan, what are you gonna be telling your patients?
Well, the first thing is certainly what people like to hear, that we have medical grade cleaning supplies.
Yeah.
They love to hear technical terms like we got the PPE. We got level 3 surgical masks or N95 masks.
So details, lots of details.
Yeah, they just want to hear that. But one of the biggest things that I've been doing is I was thinking from another viewpoint. Like, a lot of times people are afraid, there's always talk about aerosols or airborne transmission.
Yeah.
And again, there's controversy if that's true or not. But as much as I can tell, even before Corona, I had air purifiers in my office.
Oh, really?
I picked ones that are medical grade that clean to the size of viruses. Mm-hmm. And so for me, even before Corona, I picked that because, as you know, Todd, in Austin, Texas, we have Allergy Central. And so I realized that even in my office, even if we weren't sick, but we appeared with a watery eye, sniffly nose, coughing a little, even if we're not sick, the patient might think that we're sick, even if we tell them their allergies. Yeah. So my goal, even before Corona, was to minimize that. So I had air purification already. But now with this coming in, I'm loading up. Like, I have big units. I have units in every up. And all I have to go by is by what the manufacturer tells me, what studies I can find in terms of purification of the air. So one of the things that I'm doing and approaching it from a different viewpoint for patients is I'm telling them. I made a video showing it how it works and explaining aerosol size
Oh, yeah.
viruses and how they trap. These filters supposedly trap to virus size. So that's what I'm doing. I made a YouTube video to send out to all my patients, which I did, to explain to them that we're doing everything we can to make things better. And we respect your opinion. You know, if you feel like, hey, I'm not ready to come to the dentist, that's fine. You know, we'll tell them the precautions of what we're doing. You know, some fears are justifiable, some aren't, some just need to be allayed and addressed.
Hey,
So,
Tuan, let me ask you a question. What I'm concerned about is, and I agree with you completely. We need to definitely educate our patients on what we're doing. What I'm afraid is that with all of the information that's coming across Facebook and news media and everything that goes up and down, I'm afraid that we can get into too much detail of what we're doing. And
that's true.
I think what we need to do is just give them the feeling that, hey, this is the safest room you're going to be in. We use air purification, whatever. And I think if we go into, hey, we did this, we did this, we did this, we did this, they're going to go, well, why didn't you do that? And
Sure.
I think that's going to be a big concern for patients if they want to know what the perception is of the office.
So I agree with you completely. Like all these things that I talked about, I'm being more verbose here. But when I make a video or when I talk to my patients, it's like with dentistry. You know, if you get too technical, people aren't wanting to accept your treatment. So dumb it down a little. Just throw out some highlights. And you're right. If you can create that feeling of safeness, which is true on a scientific point too, I believe. But if you can create this feeling of safeness, then you make them feel better, and they're more open and ready to listen to you, to come back, to not no show without giving you a reason, because no one wants to admit that they have fear of this, you know, or they don't want to look like a weenie. I have a fear because I might get sick. So by doing these things, you can appease a lot of them ahead of time. And in terms of business and work, reduce no shows, cancellations, etc.
Yeah, Tuan, I think you hit a good point there because I practice in an area has a lot of holistic mindsets, and they're really particular about germs, and you know, perception's everything, regardless of what we're doing. Perception of safety and security, which you know, I talked about that several times in the past webcast, and I think we have to really do that. Of course, a lot of our patients already trust us.
Yes.
But I like the idea of making a video, and Alex Nudell with Revenue Well yesterday talked about that too. You know, get your iPhone out, connect with your patients. They need to see your eyeballs. They need to hear your spirit. And they need to know that we're thinking about them and that we're getting ready for them when we come back. And that's what I hear you talking about.
Yeah, and you know what? A lot of times it's I get this feeling, or it's my impression at least, it's that they just want to see that you have some action because you care.
Mm-hmm.
You know, like, you know, if you took the effort to make a video, even if they don't watch it and they screen through it for 5 to 10 seconds to see what you have to say, the fact that you made this effort in their mind, and remember, we're all human beings that take shortcuts to analyze information. We're not going to think everything through logically, but if they say, in their mind, they may say, okay, you did this, thus I know you already, thus you're a caring person. I'm just going to accept that you're doing everything you can to make me feel safe when you do reopen.
Yeah, people want to care. You know, yesterday after we did our Facebook Live, Todd, I went and saw the emergency and, you know, took care of the procedure. And then we went out into the parking lot and just chatted for a while. And afterwards, he texted me and thanked me for just spending some time with him. And, you know, we all do that. We're on a busy schedule, but I think the way I'm going to come out of this differently is knowing the fact that these people trust us. They provide our livelihood for us, and we're giving them care. But it kind of puts things back into perspective, even at home with the family. You know, you mentioned, Glenn, that you're there and you're watching your daughter more and you're with her more than you could. So it kind of like resettles our priorities, doesn't it?
Oh, I fully agree. Like, now that I think back a month, or I don't even know how long we've been off work. Let's just say a month. A month ago, I was worrying and fretting about the stupidest things, and it's taken me some time to like adapt to this slower schedule. But I mean, it's kind of nice. This is the opportunity of my life because I don't know how your personalities fully, but many of us, we're kind of type A. We're kind of, you know, we're always thinking ahead about what's next to do, and that's who I am. So to me, one of the things I've been trying to focus on is this is the first time in my life where I am forced and I have the ability and the opportunity to remind myself every day. And I tell myself, just relax, just chill out. It's taking me some time to get here, but I feel like I'm a little less short to feel temper or anger. I just,
Well, you got a brother in spirit here. I told my wife, I said, this is the most time that we've taken off at one moment in space.
Oh, yeah. It's sabbatical.
And I'm actually starting, I hate to say it, I'm starting to almost like the lifestyle. And I'm staying busy with the other side of my career. That's my online. So it gives me more time to do that. But I'm still staying focused. But, you have to adapt to these things. And I think it's the emotional side that it's interesting for me, at least.
Yeah. I mean, I agree with you. I mean, like I said, if we accept this time off, some states have 3 weeks left, some states have 4 weeks off, or maybe longer. I mean, just use it. I mean, accept it, enjoy it, and try to make some changes in your life because, unfortunately, we don't know what's going to happen in the future. Hopefully, there'll be vaccines coming up soon. There's some trials I read in some other UK or something like that. But if not, if there's going to be a second wave or something like this, then of course we do as much to prepare. But mentally, one thing that I always try to do is think about potentially what's in the future. I'm already mentally preparing myself that for the next year or so, we may have unsteady prediction of how work will be. I hate to say it monetary wise, but I'm accepting already that this next year or so might be the least money financially that I make my whole life.
Mm-hmm.
Yeah, it sucks, but I can't do anything about it. When I can work, I'll do the best to be safe and be effective. Yeah. But if we have other shutdowns, I'm just going to accept it. And I'm going to enjoy it. I'm going to go to the coast if I can. I'm going to exercise. I'm going to walk around the block, walk my dogs, play with my daughter.
Hey, Tuan, when we do come back, hey, man, you're already drinking beer. I still have warm coffee. Proud of you.
It's coast time. That's why.
Yeah,
I don't use that home, but it's like you have a nice breeze. It's like, why not?
So do you, when we come back, do you think it's going to be, as far as patient, is it going to be a drip situation, or is it going to be a fire hose? Where do you think it's going to happen down in your practice?
Well, that's a great question. I think this is my personal opinion, but I think it depends on your locality and your demographics, of course. Let me explain. I think in areas that are more hourly wages, because we see that based on the unemployment rates, it's mainly people that are on hourly wages that have lost their jobs.
Yeah.
As such, if your demographic is of that nature, it is, in my opinion, more probable that for those types of practices, it's going to be slower. It's going to take some time to build up again. Because if you're hourly, you're unemployed, sure, you got government support right now, but your job might not be present when you come back, because a lot of those industries, like restaurants or whatever industries are like that, they are most likely suffering, closing. I mean, there are a lot of restaurants, famous restaurants in Austin that closed recently.
Mm-hmm.
So I think for those practices, it's going to take time. I think if you're in a more white-collar tech area, like my area, like I said, among all my friends, I'm literally the only person without a job. All my friends work remotely at the moment. They have full jobs, they're busy, us busier, but they're probably telling me they're actually working more efficiently because no one's there to hassle them about meetings all day or stupid stuff. So they're getting their work done quicker. And so for those types of businesses, I think they're going to rebound pretty quick. So in my office, I know because I've been looking at the hygiene schedule, looking at the email messages. I got appointments wanting to be scheduled and piling somewhat up already. My hygiene schedule is packed all the way till June already because of this closure and more. And then we'll probably have to open half a day or something, even if I don't want to work to get hygiene in to fill it up some more. So I think it depends on the area. If you're in an area where the jobs have been continuous, tech areas, white-collar areas, then chances are I think it'll return to normal. I think there will be actually a rise in demand. It'll drop a little. And then it'll be maybe a little less after that, but not too much, and then slowly rise again.
Yeah.
I also think that, unfortunately, with this extended closures, there's going to be offices that close. And unfortunately for dental practitioners or dental staff, there's going to be excess of workers versus jobs. So, again, I don't wish anyone to have offices closed, and I hope everyone's busy. But for those that are working or in that position, there's going to be a glut of supply. And if you're busy, depending on the area, then you have the ability to.
Sounds like he's cutting out. James, you with me?
Did my AirPods die?
Yeah, I think they died.
I hear it in part. There you go.
Well, while you get yourself together, I think when we get back, just as I was hearing Tuan say all that, is that we're going to have to be even more careful and precise in our wording on our treatment plan presentations, because a lot of people have gotten to the point where we are.
Sorry, can you hear me?
Yeah, we hear you now.
Yeah, you're good.
Sorry, my AirPods died, so
that's okay.
It happens.
Be a little different.
Yeah, no, you're good.
Well, we want to give people hope, and I know you run the Dental Maverick. You want to tell us a little bit what the Dental Maverick is all about?
Yeah, so Dental Maverick is something that I've done at this point 6 or 7 years now, I believe. A lot of us as dentists, we're very technical. We're very smart people. What I mean is that, we've been trained and hammered by dental school to be very methodical, very repetitive, and very logical about what we do. And we reproduce it, and it works. So Dental Maverick was created because I realized as a dentist, that's one part of all of us. But for success in dental practice, and success in this point, I'm meaning is not clinical. I encourage everyone to be best clinician as much as possible. I mean, I took Todd's class. He's the one that taught me to be a CERC doc. But beyond that, success, meaning financial productivity in your office, depends on more than just clinical skills. You need to have skills where you enjoy talking to people. You need to have skills where you can talk to patients, you can look your staff in the eye, you can be a manager and a leader, because success in a dental office requires you as the boss to create a team that works with you instead of against you. So what that means is, like in my office, I believe everything is a team effort. Certainly everyone looks up to me because I'm the doctor, but I tell everyone in my office, you are very important. And believe it or not, people have a lot of credence in what you say. So what you say is very important, It's like when we go to a restaurant. Sometimes we go to a new restaurant, we're not sure what to get. We ask the waiter, what should we get? Or the waitress. Are they an expert? We don't know that. We just assume they are because they're working there.
Yeah.
So if I teach my staff to empower them, hey, you know what we do. And I train them to understand what we do. And then so every step along the way, they can help out and impart value or just make a comment here and there. And then it all adds up. It adds up for increased treatment plan acceptance. We're talking about enjoying things and seeing the hope of things. Our careers are long. It's a hard career, a hunchback, your neck hurts, your back hurts. You're trying to get that angle because you're a good doc trying to get that proper margin. And so,
that's right.
Yeah, we all do it. I got days where I know I bent my neck wrong just for a patient, and it bites me for the next week or so. And I'm like, why did I do that? Just tell the patient to turn their head a little more, Well, we do that because we want to do good jobs.
Yeah.
And so I lost my train of thought for a second there, but I did lose my train of thought. But the reason that we do all this is that we're trying to be good doctors, and being good doctors is more than being a clinician. Get your team with you. It helps out everyone. It's a win-win situation in the long run because patients get the treatment they need. They're not upset with you. They understand the value of what you wanted. It's not a given. It's not just a take. It's an even give and take based on mutually agreed principles and outcomes.
Well, Tuan, I know one thing about you for sure. You're a dynamo. You have tons of energy, and I think a lot of people that are coming out of this virus hiatus, let's call it, they need about 1/10 of your energy. They're gonna be just fine. And there's a saying: if you can't make it, fake it. So those people out there that are really depressed, man, you just need to go over to the Dental Maverick Facebook page, and you'll get tons of energy.
Spend a long time there.
Hey, Tuan, thanks so much for joining us.
Tuan.
Go catch another fish for us, okay, buddy?
Yeah, sorry my AirPods went out.
Hey,
it happens.
Your energy was alive and just beaming out.
Yeah, if you don't mind, just pop off Skype after we're done, okay, bud?
Hey,
I'm sorry, log off Skype?
Yeah, just you got a lot of wind noise. Thanks, bro.
Okay. See
hey,
ya.
thanks,
Have a
buddy.
good one. Bye.
Thanks for being.
Yeah, no. Well, first of all, I'm jealous because he fly fishes, and I used to make my own fly rods years ago,
Yeah.
and it was one of my hobbies. And he and I have always wanted to go down to the coast and go fishing. His house down there was totally blown away by the hurricane, and he was like one of the worst devastated areas. But just like your fire area, these calamities, we got to work through it, whether it's
Yeah, we do.
through our family, our faith, our friends, and that's what we're doing here. We want.
Well, I appreciate his energy, Todd. It's just I've really been blessed by talking to our colleagues online, and that's why we're doing this, right? Because the community of ideas and thoughts and perspectives kind of help us through this. Because I share a lot with him where my mind's very active, and I've been getting up and going to the office for 37 years. And this is really unusual for me. And yet it's a good time to sit back and develop some perspectives, maybe balance out perspectives that maybe we didn't do before. And go ahead.
Oh, I got something to show you.
Yeah.
I got another one of your textbooks here.
Occlusion.
Yeah, from Ramford and Ash. Isn't this what you learned in dental school?
Yep.
This book is, I was thumbing through it. I have just so everybody knows, I don't know, I like collecting like old dental stuff. Like I don't need the old cabinets because they all smell. They have that old former creosote smell. It's so bad.
Yeah.
They can stay in a museum.
Every once in a while, I'll get a whiff of a book, and then it takes me back to school because that's what we were all about was books, particularly my organic book. I still have that book, and I have, it's probably about 400 pages, and I loved organic chemistry. It was, and just the smell of the book takes me back to the smell of the classrooms.
Yeah. Well, this book, the one I've got, I got it like a pawn shop or like an old bookstore, and I found a bunch of.
Cool. Yeah.
This was 1966, Ramford and Ash, and it. As I thumbed through it, and they were talking about working interferences and everything, and I was just imagining the technical difficulties that they probably had at their time just to get a picture in a book. And
Unbelievable.
Then the next thing I thought of is some of our younger colleagues. This is the index. I know you can't see it because I'm a little bright here. That's where you look things up. This was pre-Google days. This is where you had to look. Yeah. But anyway.
Amazing. Well, one thing I've been doing during this downtime is getting out my books. Every time I go to the AACD every year, I always buy some books that I read through the next year. And I'm reading several books on ceramics and aesthetics and also the appreciation of light and color and opalescence and fluorescence, all these things that we rely on to make things look good, but understanding them kind of helps us to have better critical thinking and understanding for making choices in the future. So use
James,
the downtime to get educated. Yeah.
When was the first time you used a computer, actually?
It was physics lab. That would have been 1979.
Oh, my gosh. Probably.
And we were doing some of our lab work, and it was a huge keyboard, and the computer was in the room. The housing was in the room next door, and it was huge. And we thought we were like there.
Yeah.
And
I never used a
computer.
I never used a computer until dental school. I never used it the whole time I was in college. Never used one.
Yeah.
I was afraid of them. And
there may be something about me you don't know. When I was in college, I was part.
Do I need to pause this video right now? I don't.
Yeah, I was
don't
part
need
of the
this
nerd
public.
club, and I had the Hewlett-Packard calculator. And if you could wear it on your right belt side if you were part of the nerd club, and I was definitely part of that in college. Just thought I'd let you know that.
I can only imagine.
Thing hasn't gone away. I'm still a nerd, but
no, you're not. You're a good guy. Well, my point of all this is I read every day, but it's always off of a screen now, and so I consume a lot, but there are times where I just want to sit down and open the old book. And so I think one of the things I'm going to do while I still have a few weeks left is I'm going to open up some of my old textbooks and just start thumbing through them, and and get off a Google search, and I'm going to do more of an index search. And I think that's kind of the quiet time that we don't let ourselves have anymore. We need to take advantage of this time for that. So
quiet type. It's always healthy.
Yeah, absolutely.
Well, this was fun today, Todd.
Yeah. Now I'm jealous. I got to go catch a fish now. He that bothers me that he can just sit on the coast, and I got to do this.
Well, you can get on your motorbike and be there fairly fast, if I understand.
That is a good idea. I go in phases. There's sometimes where a whole year I'll just fish, and then the next year I'll be focused on something else. In fact, I'm sorry, I'm going to keep this going just for a minute. People make New Year's resolutions, and I'm going to, exercise more. I'm going to watch less TV or whatever. And you start that January 1st, about January 7th, you've forgotten all of it. What I've done over the last 10 years is I dedicate my year to one thing, one interest. And so it's easier than just saying I'm going to do all these things. So this last year was the year of the motorcycle for me. So I became consumed in learning motorcycles, going to MotoGP and learning different things and stuff. And I'm having so much fun. I'm going to continue it into 2020. So it may just be my
I like your hobbies with your motorbike and your photography. One thing I've noticed about you, Todd, through the years is that whenever you take something on, you probably have this deep sense of curiosity, but you really master it. And I really admire that in you.
Well, I don't know about that. This is the second time for me to host this. I made a couple other rookie mistakes. So you're still the pro.
Doesn't matter.
You're the pro, my friend.
We all learn from our hiccups. It's just part of the journey. And
I haven't asked you. Do you think this is going to be a drip, 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 or do you think this is going to be fire hose when we come back?
I think Fran had Dr. Fran had a really good comment on that. I think a lot of it depends on who your client base is, where you are. Mm-hmm. We don't really know yet, and I think my message would be to people would be this. The attitude we take is going to have a big impact on probably what happens, and we have to be sensitive to clients. The only thing I'd relate it to is 2008, because I know in 2008, for a year afterwards, my production dropped 50%.
Oh, is that right?
Yeah, but part of it is because I have a fee-for-service practice, and a lot of my services are elective. Mm-hmm. But what I found is I pivoted, and I went back to more of a general practice. Mm-hmm. I took up implants, and I found that people kept doing implants. Oh. So just like Homley said, he says the ideal practice is to have a full service practice and then develop the passions you have around that. In fact, in 2008, I started doing endo again and got all the equipment. And so I think we will need to adapt somewhat, and I think each area is going to be a little different. But we have to keep our faith alive and our hope going, because this is what we do. And our prior fathers and great-grandfathers, going way back in generations, all had to pivot because of circumstances in life. And that's nothing new to the history of this world. I've actually think we've had it better than if you go back several hundred years. Mm-hmm. They didn't have as many options. Life was more difficult. And life is still difficult today. Don't get me wrong. I want to be sensitive to everyone, because there's people out there hurting. Absolutely. And I feel like I have a very blessed life. I've worked hard. I look at my father. He came from nothing. He was an immigrant from a family. They had nothing. And he was a hard worker. And reason why I love living in the United States is that it's given me an opportunity to work hard, stay focused, and enjoy that. So, and I'm not saying I haven't suffered heartache. I have. But I'm really grateful that I've had the opportunity to make a difference in the world. And we have a country that allows us to do that. So I always have to keep a grateful heart for that. Yeah. I know you and I don't want this to turn into a political thing and everything, but as far as
civil liberties and things like that. This has been a very weird time for our country.
Been different.
It's been strange, and I don't want to get into all the details and controversies of this, but one of the things that I think is going to happen that comes out of this, especially the United States, because we have a different Bill of Rights and freedoms, is that I think in a year's time from now, when we can look back at this summer or spring and we can say, this is what worked, this is what didn't work, and this is what, America is based off of. And so I'm really hopeful coming out of this. In my very conservative world of Texas down here, there's a lot of people that are not. And I think we need to put more faith in the DNA of our the United States.
Well, hardship, what hardship does. My dad shared with me stories during World War II and after, and what hardship does to a society, it helps them to refocus and look at their value system. Because when things are going well, you can just take things for granted. I have in the past, and when things get tough, it actually defines who you are. Yeah. Because it brings out your strengths, and also it will bring out areas to grow. Yeah. So. All right. Hey, it's great. Hey, thanks for chatting, and it's been great. I feel better already. I'm ready. See, I'm on the West Coast, so it's earlier in the morning for me than probably a lot of our audience, but I'm ready to go for it, and I feel motivated and invigorated to go do something.
Yeah, well, we're coming right back here with Adam Nolte. He's in the UK, so a little bit later time zone for us, and it's going to be interesting to hear how they're dealing with this in the UK and Europe, because we're so focused on what's happening to us.
Yeah, I can't wait to meet him online, because I've been checking him out on Facebook for quite a while. Yeah, he's very creative, and he's a very knowledgeable person.
He's a great guy. Hey, tomorrow we have John Nosty. We're going to start a little bit later in the day tomorrow. We've got some commitments tomorrow morning, and so a little bit later. But you can see it on the little advertisement that I made yesterday. So John Nosty, who's world renowned. This guy, have you seen him lecture before, John Nosty?
I'm looking forward to it.
He's great in academics and aesthetics. And then right after that, we have Don Bell, who's one of the executives at Ivoclar Vivadent, to kind of give us a clue on what's happening in their world and how the manufacturers are helping us. Yeah,
he's a fine gentleman. Tomorrow morning I'm doing a webinar for Ivoclar on processing zirconia and how to make it look aesthetic.
Oh, good.
And I think that will be in the morning around 9 or. That's one reason why we're later tomorrow. So if I'll post that below where to go for that on the feed. So, okay.
All right, buddy. We will come back here in probably about 30 minutes. All right.
Yeah. And hey, Todd.
Yeah.
Stay safe. Wash your hands.
I got to wash my hands. I'm going to get powdered donuts in our next episode. You'll know why here in a second.
Hey, love you, man.